Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
The nurse has calculated a low PaO2/FiO2 ratio less than 150 for a client with acute respiratory distress syndrome. The nurse should place the client in which position to improve oxygenation, ventilation distribution, and drainage of secretions? 1. Supine. 2. Semifowlers. 3. Lateral side. 4. Prone. The correct answer is 4. Prone positioning is used to improve oxygenation in clients with ARDS who are receiving mechanical ventilation. The positioning allows for recruitment of collapsed alveolar units, improvement in ventilation, reduction in shunting, mobilization of secretions, and improvement in functional reserve capacity. When the client is supine, side-to-side repositioning should be done every 2 hours with the head of the bed elevated at least 30 degrees. Which of the following conditions can place a client at risk for acute respiratory distress syndrome? 1. Septic shock. 2. Chronic obstructive pulmonary disease. 3. Asthma. 4. Heart failure. The correct answer is 1. The 2 risk factors most commonly associated with the development of ARDS are gram-negative septic shock and gastric content aspiration. Nurses should be particularly vigilant in assessing a client for onset of ARDS if the client has experienced direct lung trauma or a systemic inflammatory response syndrome, which can be caused by any physiologic insult that leads to widespread inflammation. Chronic obstructive pulmonary disease, asthma, and heart failure are not direct causes of ARDS. Which of the following individuals has the highest priority for receiving seasonal influenza vaccination? 1. A 60-year-old man with a hiatal hernia. 2. A 36-year-old woman with 3 children. 3. A 50-year-old woman caring for a spouse with cancer. 4. A 60-year-old woman with osteoarthritis. The correct answer is 3. Individuals who are household members or home care providers for high-risk individuals are high-priority targeted groups for immunization against influenza to prevent transmission to those who have a decreased capacity to deal with the disease. The wife who is caring for a husband with cancer has the highest priority of the clients described because her husband is likely to be immunocompromised and particularly susceptible to the flu. A healthy 60-year-old man or a healthy 36-year-old woman is not in a high-priority category for influenza vaccination. A 60-year-old woman with osteoarthritis does not have a higher priority for influenza vaccination than a home care provider. After teaching the parents of a neonate diagnosed with a tracheoesophageal fistula about this anomaly, the nurse determines that the teaching was successful when the father describes a condition as which of the following? 1. The muscle below the stomach is too tight, causing the baby to vomit forcefully. 2. There's a blind upper pouch and an opening from the esophagus into the airway. 3. The lower bowel is lacking certain nerves to allow normal function. 4. A part of the bowel is on the outside without anything covering it. The correct answer is 2. Although a TEF can include several different structural anomalies, the most common type involves a blind upper pouch and a fistula from the esophagus into the trachea. Other types include a blind pouch at the end of the esophagus with no connection to the trachea and a normal trachea, and esophagus with an opening that connects them. A tightened muscle below the stomach and projectile vomiting of normal amounts of formula are characteristic of pyloric stenosis. A ganglionic megacolon is a lack of autonomic parasympathetic ganglion cells in a portion of the lower intestine. Gastroschisis occurs when the bowel herniates through a defect in the abdominal wall, and no membrane covers the exposed bowel. When developing a plan of care for a neonate who was diagnosed with an anorectal malformation and who subsequently underwent surgery, which of the following would be most helpful in facilitating parent-infant bonding? 1. Explaining to the parents that they can visit at any time. 2. Encouraging the parents to hold their infant. 3. Asking the parents to help monitor the infant's intake and output. 4. Helping the parents plan for their infant's discharge. The correct answer is 2. Encouraging the parents to hold their neonate promotes parent-infant attachment. Parent-infant bonding is based on a relationship that begins when the parent first touches the infant. Both the parents and the infant have predictable steps that they go through in this process. Explaining that the parents can visit at any time promotes bonding only if they do visit with, talk to, and hold the newborn. Asking the parents to help monitor intake and output at this time may be too anxiety-producing, thus interfering with bonding. Helping the parents plan for the infant's discharge, involve them in the newborn's care, and is important. However, it is not the first step in the development of bonding. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The primary healthcare provider prescribes intermittent fetal heart rate monitoring for a 20-year-old obese prima gravida client at 40 weeks gestation in the first stage of labor. The nurse should monitor the client's fetal heart rate pattern at which of the following intervals? 1. Every 15 minutes during the latent phase. 2. Every 30 minutes during the active phase. 3. Every 60 minutes during the initial phase. 4. Every 2 hours during the transition phase. The correct answer is 2. Labor is categorized into 3 phases: latent, active, and transition. During the active stage of labor, intermittent fetal monitoring is performed every 30 minutes to detect changes in fetal heart rate, such as bradycardia, tachycardia, or decelerations. If complications develop, more frequent or continuous electronic fetal monitoring may be needed. During the latent phase, intermittent monitoring is usually performed every 2 hours because contractions during this time are usually less frequent. During the transition phase, intermittent monitoring is performed every 5 to 15 minutes because the client is getting closer to birth the baby. There is no initial phase of labor. A primiparous client who has just given birth to a healthy term neonate after 12 hours of labor holds and looks at her neonate and begins to cry. The nurse interprets this behavior as a sign of which of the following? 1. Disappointment in the baby's gender. 2. Grief over the ending of the pregnancy. 3. A normal response to the birth. 4. Indication of postpartum blues. The correct answer is 3. Childbirth is a very emotional experience. An expression of happiness with tears is a normal reaction. Cultural factors, exhaustion, and anxieties over the new role can all affect maternal responses. So the nurse must be sensitive to clients' emotional expressions. There is no evidence to suggest that the mother is disappointed in the baby's gender, grieving over the end of pregnancy, or a candidate for postpartum blues. However, approximately 80% of postpartum clients experience transient postpartum blues several days after childbirth. To determine whether a prima gravida client in labor with a fetus in the left occipital anterior position is completely dilated, the nurse performs a vaginal examination. During the examination, the nurse should palpate which of the following cranial sutures? 1. Sagittal. 2. Lambdoidal. 3. Coronal. 4. Frontal. The correct answer is 1. The sagittal suture is the most readily felt during a vaginal examination. When the fetus is in the LOA position, the occiput faces the mother's left. The lambdoid suture is on the side of the skull. The coronal suture is a horizontal suture across the front portion of the fetal skull that forms the anterior fontanelle. It may be felt with a brow presentation. The frontal suture may be felt with a brow or face presentation. The nurse is caring for a prima gravida client in active labor who has had 2 fetal blood samplings to check for fetal hypoxia. The nurse determines that the fetus is showing signs of acidosis when the scalp blood pH is below which of the following? 1. 7.5. 2. 7.4. 3. 7.3. 4. 7.2. The correct answer is 4. If the fetus is hypoxic, the pH will fall below 7.2 and be indicative of fetal distress. This finding typically requires immediate vaginal or cesarean birth. A scalp pH reading of 7.21 to 7.25 should be repeated again in 30 minutes for assessment of hypoxia and acidosis. Transfer data for a client brought by ambulance to the hospital's psychiatric unit from a nursing home indicate that the client has become increasingly confused and disoriented. The client's behavior is found to be the result of cerebral arteriosclerosis. Which of the following behaviors of the nursing staff should positively influence the client's behavior? Select all that apply. 1. Limiting the client's choices. 2. Accepting the client as he is. 3. Allowing the client to do as he wishes. 4. Acting nonchalantly. 5. Explaining to the client what he needs to do step by step. The correct answers are 1, 2, and 5. Confused clients need fewer choices, acceptance as a person, and step-by-step directions. Allowing the client to do as he wishes can lead to substandard care and the risk of harm. Acting nonchalantly conveys a lack of caring. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client with acute respiratory distress syndrome has fine crackles at lung bases, and the respirations are shallow at a rate of 28 breaths per minute. The client is restless and anxious. In addition to monitoring the arterial blood gas results, the nurse should do which of the following? Select all that apply. 1. Monitor serum creatinine and blood urea nitrogen levels. 2. Administer sedative. 3. Keep the head of the bed flat. 4. Administer humidified oxygen. 5. Auscultate the lungs. The correct answers are 1, 4, and 5. Acute respiratory distress syndrome may cause renal failure and superinfection, so the nurse should monitor urine output and urine chemistries. Treatment of hypoxemia can be complicated because changes in lung tissue leave less pulmonary tissue available for gas exchange, thereby causing inadequate perfusion. Humidified oxygen may be one means of promoting oxygenation. The client has crackles in the lung bases, so the nurse should continue to assess breath sounds. Sedatives should be used with caution in clients with ARDS. The nurse should try other measures to relieve the client's restlessness and anxiety. The head of the bed should be elevated to 30 degrees to promote chest expansion and prevent atelectasis. Which of the following assessments is most appropriate for determining the correct placement of an endotracheal tube in a mechanically ventilated client? 1. Assessing the client's skin color. 2. Monitoring the respiratory rate. 3. Verifying the amount of cuff inflation. 4. Auscultating breath sounds bilaterally. The correct answer is 4. Auscultation for bilateral breath sounds is the most appropriate method for determining cuff placement. The nurse should also look for the symmetrical rise and fall of the chest and should note the location of the exit mark on the tube. Assessment of skin color, respiratory rate, and the amount of cuff inflation cannot validate the placement of the endotracheal tube. The nurse is a member of a team that is planning a client-centered approach to care of clients with chronic obstructive pulmonary disease. Using the chronic care model, the team should focus on improving quality of care and delivery in which of the following areas? Select all that apply. 1. The community. 2. Clinical information systems. 3. Delivery system design. 4. Administrative leadership. 5. Emphasis on the acute care setting. The correct answers are 1, 2, and 3. The process of changing a healthcare system from an acute care model to a CCM uses continuous quality improvement methods. The goal of the CCM is to improve the health of chronically ill clients. The CCM identifies 6 basic areas upon which healthcare organizations need to focus to improve quality of care and delivery: health systems, delivery system design, decision support, clinical information systems, self-management support, and the community. This system requires healthcare services that are client-centered and coordinated among members of the healthcare staff and client and the family. CCM does not focus on the administrative leadership or the care in the acute care setting alone. Which of the following would indicate that an infant with a tracheoesophageal fistula needs suctioning? 1. Brassy cough. 2. Substernal retractions. 3. Decreased activity level. 4. Increased respiratory rate. The correct answer is 2, with a TF. Overflow of secretions into the larynx leads to laryngospasm. This obstruction to inspiration stimulates the strong contraction of accessory muscles of the thorax to assist the diaphragm in breathing. This produces substernal retractions. The laryngospasm that occurs with a TF resolves quickly when secretions are removed from the oropharynx area. A brassy cough is related to a relatively constant laryngeal narrowing, usually caused by edema. It is not an indication of the need to suction. A decreased activity level and an increased respiratory rate in an infant with a TF are usually the result of hypoxia, a relatively long-term and constant phenomenon in infants with a TF. A 4-week-old infant admitted with a diagnosis of hypertrophic pyloric stenosis presents with a history of vomiting. The nurse should anticipate that the infant's vomitus would contain gastric contents and which of the following? 1. Bile and streaks of blood. 2. Mucus and bile. 3. Mucus and streaks of blood. 4. Stool and bile. The correct answer is 3. The vomitus of an infant with hypertrophic pyloric stenosis contains gastric contents, mucus, and streaks of blood. The vomitus does not contain bile or stool because the pyloric constriction is proximal to the ampulla of Fata. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.